Hi, welcome to Healthy Kingston. I'm Janet Wade. We have a very busy program today, and the first half is going to be very COVID driven. We're going to have a nurse telling you about the status of COVID in the community, which sectors of the population it is impacting. We're also going to have the nurse who's over the nurses in the schools in Kingston, who's going to be speaking about precautions in the Kingston schools that are being taken regarding COVID in the students. And then we will be having a counselor who has been working with the students and the families as to the impact of COVID on the students and their families, and also when to seek professional help. And then the second part of our program, we're going to be having a physical therapist who's going to be talking to all of us about how to, the importance of being evaluated by a physical therapist as we get older to help us with our flexibility, our mobility, stability, balance. And she has a lot of very encouraging things to say, because actually I went to her. So with that said, I would first like to introduce Leanne McGuinness, who's the nurse that works here in the town. She has been doing an exemplary job of getting everyone vaccinated who is interested in doing so.
Hi, my name is Leanne McGuinness. I'm a public health nurse here in Kingston. Just touching base with this week's report as far as COVID cases. We are still on the increase. Just like nationwide is, we have a lot of children between the ages of 0 and 11, a lot of positive cases in our community. It's affecting the schools, daycares currently right now, senior living. We have a vaccine clinic starting this Saturday at 10 o'clock at the Kingston Intermediate School. It's very important that we get out there and we start getting vaccinated and do our part if we're not, and to protect ourselves. This is a shield to help us protect ourselves in this COVID battle. Sadly, to report, we had 2 deaths right here in our community that could have been prevented. So if you can do your part as far as getting vaccinated, help us defeat the battle of COVID and working together to get our community back up and running. And please, again, Kingston Intermediate School, it is the school, the 3 to 6 graders school. It will be this Saturday from 10 to 1. If you do not have an appointment, you can just walk in. We will be happy to vaccinate you. And if you have any questions, please reach out to our health board. Thank you.
I also want to let you know, for filming purposes, this Saturday is September 25th. However, there will be a clinic again in October. And there's a reverse 911 call that's going to be going out to notify everybody when these clinics are going on. And you can also look at the town website. Thank you, Leanne. You're doing a terrific job. We appreciate it.
Thank you, Janet, for always having our interest best at heart. Thank you.
Next, I'd like to introduce Carol Beck, a very familiar face for the students and the parents in the Kingston school system. She is a registered nurse who oversees all of the nurses that are working in the schools. And she is going to be speaking, being that it's the beginning of the school year, what type of precautions are being taken in the schools to prevent the children from getting COVID, preventing a COVID spread, and other practices that are being put in place. So with that, Carol, hi, good to see you.
Hi, Janet. Thank you very much for including me today. So we want to talk a little bit about the mitigating factors and strategies that we're using coming back in this year. They're very similar to how we went out last year with a few added mitigation strategies. The first and foremost are hand washing. We're distancing when we can. We're all masking in the schools. As we know, ventilation in the schools have been upgraded where needed, and vaccinations are happening, 12 and up, age appropriate. Contact tracing with positive cases, and we have very few in the schools, and we're hoping to maintain our goal of last year where we had no in-school transmission. So we're hoping to stay along those lines this year. We're also incorporating something called Test and Stay, which is a program through CIC Health, and they've come in and they're going to help us get up and running with that program. What that program will allow would be a student who was called a close contact in the school will be able to be tested for 7 days and stay in school while they're testing negative and have no symptoms. So that will be great for us too. And the nurses, we're all following closely the DPH and the Department of Education guidelines, which there are many of. So those are our mitigating strategies right now.
Let me ask you, do you have any idea how many teens in particular, 12 on up, students have been vaccinated? Do you keep track of that?
That's a question. We have resources to what we know, and that's what parents will tell us. So the state is supposed to be coming up with a tool so that we will be able to tell in middle school and high school the percentage of students who will or have been vaccinated. And as of right now, today they have not shared that tool with us, so we're unable to have those percentages correct.
Okay. From your perspective, are you doing anything to encourage it, or how are you handling that?
Vaccination wise?
Yes.
You mean? Yeah, we're supporting the vaccination clinics that Kingston Board of Health is doing down at our Kingston Intermediate School, and have been doing since the summer. We have them, I believe they're all the way, Leanne will make sure I'm correct, all the way up through December. And those go out to families and community members informationally right before they're coming up. They're on Saturdays. In fact, there's one, I believe, coming up this week at the intermediate school. So yeah.
What can you walk us through a situation? A child isn't feeling well, goes to the nurse, potentially has a fever, maybe coughing, runny nose, question of COVID. What would the nurse do in that situation?
Again, there's the mitigation strategies that we use in the nurse's office when we have sick children. So the nurses will use their assessment skills and their nursing judgments, and there's a clear defined listing of what is specific to COVID symptoms that they need to follow. If in their assessment they feel as though this child may have some symptoms of COVID, then they're brought to an isolation space, and then the protocols are followed as far as whether or not, the child is masked, they're isolated, the nurses have to wear certain PPE or protective gear. There's a whole list of guidelines that the nurses use. Parents will be called, student will be picked up, and then they will be asked to see their healthcare provider or call their healthcare providers for further evaluation.
Okay, great. How do they get back into the school?
So after consultation with their primary care, and then the nurses will talk with their primary cares and the families. And if it's decided that the student is actually ill with something else, because I think it's important we remember this year that there are other things than
exactly.
So if perchance the student is assessed at the doctor's office and found to have a strep throat, then they would be treated, and then they would be brought back into school under the guidelines of our normal illness guidelines, which is lightly saying, which would be 24 hours fever free without medication, that kind of thing. So we have our regular illness guidelines that we would follow. And then if they're assessed and they're tested, maybe they're tested positive for COVID, then they would follow the quarantine recommendations.
Okay, great. Thank you. And thank you, Carol, for all you do and all the nurses are doing for the children in the schools, particularly now, very challenging time.
It is for everyone.
Okay, they're in good hands. Next, we have Renee Donohue, who is a counselor. She has a master's in psychology, and she is a counselor at Silver Lake Middle School. And there's been a tremendous amount of discussion of what is the emotional impact on children, young through teenagehood, of having COVID, being exposed to COVID, this very challenging time for all of us in society. So we're all ears, Renee, to hear what your experience has been as far as how the pandemic has been affecting the children in the schools and what you're doing to normalize the situation and also address it.
So, you know, we're noticing that students are obviously anxious. There's a lot to be anxious about. Families are anxious as well. This is something where parents can't hearken back to their own experiences because it is such a unique experience. In the past, where you've had a student maybe anxious about how to make friends, or what happens if they weren't invited to a party, and the parents can reflect on their own experiences. But here, everyone's sort of going through a new experience together that's very anxiety provoking. So for people who are prone to anxiety anyway, it's heightened. And even for people who are not normally anxious, there's a lot of worry. So we definitely have seen an increase in that. And also there's been, you know, some disruption to the normal course of what they have learned sort of socially, because they had a period of time of not being with their peers. So it's almost like, at least at the middle school level, they're kind of relearning how do I negotiate the cafeteria, you know, who to sit with, and those kinds of social experiences, because they had that time in the middle where they were, you know, more, there was a bigger buffer zone, and they didn't have those interactions.
Let me ask you, when you say they're stressed, they're showing a lot of anxiety, what type of symptoms are they exhibiting?
Yeah, so it depends on the individual children. I mean, some of them, you know, they're feeling it, but we're not necessarily hearing it. They're probably expressing it more at home, you know, and to us, they're kind of moving along and doing what they would do in a normal year. But other students, you know, need to kind of talk about it. They're coming to guidance, and that's a great place for them to come. And they're just needing a place to talk about their feelings. And they may not even say it's necessarily because of COVID, but I think it's made them a little more sensitive to other things that maybe wouldn't have bothered them. But because they're already feeling impacted when something happens, it's sort of that tipping point of, wow, in the past I would have said, nah, whatever. But because I'm already feeling stressed, that's just one more layer of something that I really feel I need to discuss. So, you know, we do see a little bit of stress in that way, and looking for guidance also on how to negotiate the things that they're feeling they almost need to relearn. Like, okay, I've got to go down to the cafeteria. How am I going to do that? You know, how am I going to figure out who to sit with? And just looking for some instruction around that, feeling a little bit, a little lack of confidence in there.
So what measures have you put in place as the school put in place to address some of these situations and help the kids feel more comfortable at school?
Sure. So we, you know, our guidance office is available to every student, and teachers are great about, you know, supporting kids in class, but also if they're seeing that they need a little bit more, to sending them our way, or if a student asks to be seen, certainly they come our way. We do have groups available if you know, students feel they want to talk about a certain situation with peers. We do have that as well. Teachers are in the cafeteria, so they're helping kids negotiate that. They're in the halls if there's any kind of point of performance help that kids need. This year, for instance, there was a lot of stress around lockers because last year kids didn't have lockers. So even our 8th graders who'd been in the building were still feeling a lot of anxiety and how am I going to get to class on time? I don't know if I can get this open. And so just having teachers there to say, we're all going to be okay. You know, we're going to work through this. Let's practice. Let's take time together. And if you don't get it this time, put your stuff in my room. This is okay. Just trying to kind of turn the heat down on some of the situations that might lead to a tearful, oh no, I can't do this, to say, we're going to be okay. So just having the adults in the building there to calm nerves and be supportive.
How do they know that you're available?
We actually, my colleagues and I have gone out to 7th and 8th grade classes and explained to all of the students how to make appointments with us, that they can reach us by email, they can come down in person, they can ask their teachers to come, if they can come down to see us. We've told them the best times to come so that they're not missing instructional time. And the teachers are really great about saying to a student who might seem a little upset, why don't you go down to guidance? Let me call now and see if there's a counselor that's available. And we also have some spaces within our guidance suite where kids can just take space, because sometimes it's not that they necessarily want to speak to someone in a therapeutic way. They just need that reset. They
Right.
need a quiet place to be for a moment. And so we've set that up for this year as well.
Have you reached out to any parents as far as them coming in with their child, or are you speaking with them about a situation that might be going on?
Oh, several times. I mean, but that's every year. That's not unique to this year. I will say there's a little more anxiety, so we probably had a few more phone calls than we have in other years. But every year we want parents to, you know, be our partners in this, in supporting their child so that they can have a successful year.
When do you think parents should seek some type of professional counseling with their child?
Yeah, I say the number one time is when the child asks for it. It's very hard for students, for children in general, to go to a parent and say, I think I need to see a counselor. And I feel like whenever a child does that, that has to be respected and supported. So I would say right from the jump, any child that asks for help should be given help. Secondly, if a parent is noticing that there's a pervasive issue, it's not clearing up real fast, a student is having trouble eating, sleeping, you're having trouble getting them to school, there's been a decline in how they do at school, or you start to see a child give up things that used to be very pleasurable to them. They liked going to a soccer practice, or they liked practicing their piano, or drawing or painting, and all of a sudden they're not doing those things anymore. And it's going on more than a day. You know, it's not just, oh, they had an off day at school, they didn't feel like doing their homework. It just is a demonstrable change in their behavior. That is a time when I would definitely say at least reach out to the pediatrician. And sometimes it's something physical, you know, and you want to rule that out. And the PD could also make a referral to a therapist. But also, if they're seeing it, please let us know here at the school. We can check in with the child as well. We have referrals for counselors that we can send out. So anytime a parent is noticing that, you got to go with your gut, your kid. And if there's a change with your child, you need to address that.
Absolutely. One last thing. We know there've been a lot of concerned parents referring to the masks and the impact of their children wearing the masks, be they little ones or up through teenagehood, the emotional duress that they might be under and wearing them. Can you speak to that, please, from your experience?
Yeah, I can say that I don't work with little kids, so I don't know how they are. I'm with middle schoolers, and I certainly have contact with some high schoolers. Our kids in the building are doing everything they've done in past years, just safely with masks on. I see them in the hall and they're laughing and they're joking and they're doing group work in classes. And I think they've kind of learned that for right now, this is our step that we have to take. And for the most part, that's going smoothly. I'm certain that not every student is loving wearing a mask, but I can tell you, I have talked to a couple who've said, I kind of like, I don't want to say hiding, but it's like it's like a safety net for some of them,
Right.
especially adolescents who are so self-conscious.
Mhm.
In a way, some of them, it's become a little bit of that for them. And so I don't see that they're working less productively or anything like that. They really seem to just be doing very well here with their masks on.
Terrific. Well, I can't thank you enough from the community for all that you're doing for the children during a very trying time, for the children and their parents. Keep up the good work.
Thank you. Thank you very much.
Well, our next special guest is just that. And she was my physical therapist for 2 months. And we established a lovely relationship. And she totally changed my life as far as my agility, mobility, balance. And so and she made the comment once that she feels as though everyone should have an annual physical therapy evaluation, which I thought was a brilliant comment as a nurse. So I just had to expose her in her wealth of knowledge to the community. So please let me introduce Dr. Erin Lothian, who is a physical therapist at Bay State at the Kingsbury Club, Bay State Physical Therapy. So Erin, thank you very much for being with us. And what I'd like to ask you first, tell us about your education from the beginning. What is the background of a physical therapist?
Yeah, thanks for having me on. For education, as a physical therapist, you start with a 4-year bachelor program. Then you go on for a 3-year grad program after that, where you graduate with your doctorate in physical therapy. After that time, you have to pass a national board exam to become a licensed practicing physical therapist. And even after that, as a healthcare professional, there are many continuing education courses that you're required to take. So you can always argue that an education of a healthcare professional or a physical therapist is kind of always ongoing too, is what I love about our field.
Absolutely. Tell me, what is the difference between a physical therapist and an athletic trainer?
Yeah. So an athletic trainer is a healthcare professional who really helps work with athletes. They help to prevent and recognize injuries. They're often the first responders when an injury happens on the field or in any kind of competition. They also help to manage and rehabilitate athletic injuries to help kind of promote return to sports and competitions.
Mm-hmm.
There's a lot of overlap with physical therapy for sure. A physical therapist, along with an athletic trainer, are often considered kind of the musculoskeletal experts in the healthcare field, which just means that they know about muscles and joints and how the body really moves together.
Mm-hmm.
As a PT, I work with people of all ages, all conditions and injuries and surgeries, and with the goal of really helping people to get back to their day-to-day activities where they are limited and what they can't do for a while.
When you first meet someone, how do you assess them? What do you assess them for?
Yeah, so typically when I go through my evaluation, when I meet someone for the first time, I really like to, we get to spend an hour together. So it's my favorite to go through and go through someone's medical history, go through their background, who they've seen and what they've been through, kind of really getting a snapshot idea of anything from where their pain is located to what kind of limitations they're having day to day. This could be anything from, having a hard time reaching into their kitchen cabinet to get those dishes down, or getting on and off a low couch, or really feeling that unsteadiness or loss of balance. After going through that, we go through a series of kind of range of motion, strength, flexibility, balance, and other tests to really determine what our plan of care is going to be. Each plan that we come up with is very individualized, and that's why it's important to spend time talking with the individuals and our patients. I consider everything from a person's medical history to their busy life schedule to really what their goals are to help come up with a plan to get them back to their day-to-day lives.
which I really appreciated personally. There was certainly nothing cookie cutter about the treatment plan for myself. And I know you asked me, what are some things you're concerned about? And I was getting my luggage over the seat on the airplane or picking up my grandchildren who were getting heavier all the time. But you really incorporated these type of things into the plan of care. So it was very individualized and I appreciated it. What are your expectations of the client?
Yeah, that's a great question. My big expectation is that people come in with an open mind and kind of be willing to change and implement these new lifestyle changes, really. I think for a majority of people, especially as we age, a lot of the limitations that we're noticing didn't come on all of a sudden. It's stuff that's been gradually building. And so because it takes a while for things to be seen that way, it also takes a long time for changes to be made too. I often joke with a lot of my patients that my magic wand is on back order from Amazon, that there's no quick fix that I can offer people. But there are a lot of lifestyle changes, anything from desk or work setup to, overall general tips and tricks for balance, for posture, for any kind of day-to-day activities that you feel you're limited with. And that's what I really love about my job too, is that I get to spend more time with my patients than your typical doctor does. I get to take the time to listen and really work on ways that we can achieve their goals. Like you said, whether it's lifting that new grandchild or, getting on and off a low couch or just walking with confidence. It's a really good thing to see when you can see those changes for people too.
Absolutely. I know it's very individual, but typically, how long do people usually spend with you?
Yeah, that's a great question. So once we go through our evaluation and we kind of figure out what our plan is going to be, this typically includes in-clinic treatments for hands-on treatment or direct supervision of activities or exercises, about 2 to 3 times per week for about an hour session, depending. All the research shows us that changes in muscle strength can take up to 6 to 8 weeks to see changes. And it depends on other factors like age that can cause a difference in some of these changes. But overall, I typically see people for about that same 2 months time. Once we get to that point, we set people up with a home program, which it's kind of that transition where you're able to do those exercises on your own that we know you're not at 100% necessarily, but it takes time for changes in strength to be made. And for a lot of people, this home program can be lifelong, that it takes 6 to 8 weeks to build up that strength, but it can take just 2 weeks for deconditioning to start in. So in order to really achieve those goals, it's really important that you continue with your home program and keeping up with the exercise and lifestyle changes. Physical therapy is a wide net, and there's a lot of benefits that you can help with. For PT, you can really help with pain management, improve mobility and movement, help with fall prevention and maintain balance, avoiding surgery and really enhancing posture. As well as promoting that kind of new exercise program or routine or those lifestyle changes, which are really important as we age.
Absolutely. Thank you so much. Again, I can speak to this personally, and that I really feel, and I know Erin does as well, that the older we get, the more this is necessary, and it certainly can improve the quality of your life. So thank you very much for being with us.
Absolutely.
Okay.
I always like to say that, it's important to see your doctor at least once a year to get blood work or general, physical, or going to a dentist once a year to kind of check out your teeth and get everything cleaned. But I would also argue that it's important to see the physical therapist once a year too.
I agree. Thank you.
Absolutely.
Well, busy program. Thank you for joining us. Stay healthy and stay safe.